Hi everybody, my name is Molly Lane, and this is the discussion video forum for Module 8 Assessment Procedures. For the purpose of this assignment, I have chosen to explore the American Counseling Association's Code of Ethics 2014. The first surprise I identified was in section E4, titled Release of Data to Qualified Personnel. According to the textbook, Shaparis et al. 2020, states that the administrator of the test is responsible for overseeing the careful scoring of an assessment. And then conversely, according to E4 of the Code of Ethics 2014, the counselor is able to submit the results to a qualified professional for scoring. This raised a few questions for me. It seems risky, just because you don't know necessarily who is going to be scoring the assessment, and you risk some sort of bias or inaccurate scoring, and really there's a lack of oversight of seeing the scoring results. Excuse me, I lost my place. And then section E6A, appropriateness of instruments, also surprised me because the ACA Code of Ethics 2014 mentions nothing about ensuring the test is age appropriate, appropriate for grade level, language, for an individual with a disability, and cultural backgrounds, different cultural backgrounds, which to me is kind of imperative, and that's missing data in my opinion. I was also surprised to find that when a counselor administers an assessment instrument, he or she must do so under the same conditions that were established in his or her standardization. This to me was a big surprise. Through school and training and learning, you would think that you kind of learn multiple ways you can do it, but you have to go with the standardization. And then section E7A, administration conditions, or that was under E7A, administration conditions. And this really caused me to question the level of adaptability that the counselor is able to provide for unique individuals with differing needs. I was also kind of surprised to find that counselors are able to utilize testing instruments that do not have empirical data supporting the use of these instruments. And this was under E9B, ACA Code of Ethics 2014, titled Instruments with Insufficient Empirical Data. And it essentially says, like, we caution you against using these, but it really brought into question, how reliable or valid is this data, and is it really going to measure what it's intended to measure for the benefit of the client, and for treatment purposes. And then as far as ethics go, I just wanted to touch on best practice. You can meet the standard level, but you should go above and beyond and try and aim to achieve all ethics. And as the counselor, you really have to be concerned with, the client's welfare, counseling competencies and their limits, who the recipients of the results are, who data can be released to, qualified personnel, diagnosis of mental disorders, instrumentation, conditions of assessment and administration, multicultural issues and diversity, which is a huge one, scoring interpretation, assessment security, obsolete assessment and outdated results, and assessment construction. And then lastly, as far as Christian worldview is concerned, I just wanted to state the verse from Galatians 5:22 that says, "But the fruit of the Spirit is love, joy, peace, patience, kindness, goodness, and faithfulness." And I feel like this piece of scripture is really pertinent here, just because, as a Christian counselor, you need to possess these qualities in order to do right by your client. So thank you so much.